You cannot imagine how annoying it can be to have long labia minora. Sometimes they get trapped, sometimes they get a lot of rubbing that is really hurtful, and it's a really something that takes freedom away from women. So if you're suffering from any of these situations, in this video I'm going to talk about how to improve the vagina aesthetics. Hi, I am Dr. Lina Triana, and today we're going to talk about how to improve the vagina aesthetics. Many patients come to my office to talk about how unhappy they are about how they look down there. Their labia minora many times are big, and we ask ourselves why. Well, many times we're born with long labia, but sometimes during adolescence, when we have the peak, when we really grow high or grow quickly in the adolescence times, in that moment we have a high estrogen in blood, and that high estrogen levels make the labia minora grow, and sometimes grow too much. Also, they can grow during pregnancies, because during pregnancies we also have high levels of estrogens. And then once they're big, we're stuck with them. Many times when they're big, they can pinch you when you have tight clothes, or when you do sports, when you do biking, when you horseback riding, and in the gym they can be really annoying. Also, with that woman that are really fit, today there's a tendency of being really fit, no fat, and going a lot to the gym. And when you sweat a lot and you have long labia, that can be a really suffering situation. Why? Because the labia, with sweating, wet and long, with the friction of whatever you're wearing on that exercising moment, can really bring you sores in that area. And of course, they come with pain and with constant infections that are not nice to live through. Also, during sexual intercourse, they can interfere with your sexual relationship and really make you feel not secure about it. And of course, they can look ugly. We just don't like them. And if that's your case, we can help you getting rid of them. It's important to understand that God made labia minora for a reason. So those patients that want me to take them all out, that's not right. That Barbie look, meaning taking everything out, is not right. Labia minora are there for a reason. They are like the door that takes care of your inner vagina. When you're young, if you don't have any labia, you will be okay. But as soon as you age, remember that with menopause, we start to get a dry vagina or less lubrication. And if you don't have any door to close it, you will be more prone for that irritation that can be suffered when you have that dry vagina. So make sure and always leave some labia. Many specialists will go ahead and cut everything. Please don't make them do that. Don't push the doctor to do that. It's important to have labia. So we will, of course, will train them. We'll cut whatever excess there is, but there should be some kind of labia, at least some millimeters, for a good closure of the external introitus or the entrance of the vagina. Also, when we talk about vagina aesthetics, the outside of the genitalia, it's important to know that we also have something that's called the clitoris hood. The clitoris hood is like the skin that covers our clitoris. And if that's excessive, can be a problem. Many times we have bad odor down there. We have an excessive clitoris hood that doesn't let us clean the area well. So if we take that excess, maybe that bad odor can go away. Just like with men that sometimes have an excess around their gland, their penis gland. Also, an excessive clitoris hood can give us the appearance of a penis, and we don't like that. So if we do the vagina plastic surgery procedure, the vagina design, we can help to take away that excess clitoris hood, or what we also call a hoodplasty. Another situation can be when women go to the gym and then decide to inject hormones, or sometimes use those pellets that are put in the gluteal area. Injecting hormones or having extra hormones in our body can bring bad situations to us, such as a clitoris that can grow too long or too thick. A too long clitoris, we can sometimes help with the surgery, bring it down or back a little bit. But a thick clitoris will not be resolved. So make sure and don't get extra hormones on the gym. So go ahead and get the muscle with a good exercise routine and forget about those hormones if you don't want changes that many times are irreversible in the genital area. Another thing that we should take into consideration is the posterior fold of the vagina. That is formed when the two labia minora come down in the perineal area, in the area that is next to the anus. That fold is a must in women. Many times we have excess fold and we ask the surgeon to cut it. And surgeons that don't have the knowledge, training, and experience will go ahead and cut it because it's pretty easy to cut and suture. But if we do that, that patient can have trouble when they have sexual intercourse because that area will end up being tight and they can have tearings. So please go to a specialist, someone that really understands the procedure, again, that has the training, knowledge, and experience, that really knows what's doing, that listens to you so that you are safe when you perform any procedure in your genital area. When we talk about procedures to enhance the vagina aesthetics, they are pretty safe procedures that do not need you to go to the OR, do not need you to go under general anesthesia. These procedures can be done under local anesthesia, pretty simple, 1 hour, sutures that can be reabsorbable, although I usually like to take them away. And what I ask is the first 8 days to don't use tight pants, just dresses, and have the area as dry as you can. And of course, no heavy lifting, no exercise, no sexual intercourse for 4 weeks. If you want to improve your vagina aesthetics, if you're suffering from any of the inconveniences that have been previously described in this video, go ahead and contact us at www.drlinatriana.com. Ask for a virtual appointment that we can discuss what really bothers you and how I can better help you fix it. And of course, follow us on our social media and subscribe to our YouTube channel.